Welcome, and thank you for joining me for the latest COVID-19 virtual town hall meeting. Based upon your feedback, we've shortened this episode while using this time to address some of your questions about the COVID-19 pandemic. Joining me today is Dr. Alan Kachalia. He is Senior Vice President of Patient Safety and Quality for Johns Hopkins Medicine. And today we're going to get his unique perspective, not only because he's a physician, but he has also been diagnosed with COVID-19 and is willing to share with us today what he learned through his own experiences. As of today, over 200 of our employees across Johns Hopkins Medicine have tested positive for COVID-19. Very few have required hospitalizations, and for those who have, they have recovered very well. What's interesting about that number 200 is that the majority of our employees are getting it through community spread, not nosocomial spread internal to our organization. So I want to thank Alan for doing this for us today to really begin to explain what the experience was like. So Alan, thank you for joining us today. And first of all, I'd like for you to describe for folks how it all started for you in terms of the clinical symptomology and how did you feel sick initially?
Sure. It's a pleasure to be here, Kevin. The symptoms, I think like it did for many people, it started off pretty benign for me. I woke up one morning, I had a very, very slight sore throat, and frankly, I thought nothing of it. But for the fact that there was so much going on in the news, we had begun to try to shut things down here. I decided to stay home from work that day because I just wasn't sure if these were the real symptoms. And this was back when the main symptoms that we were told to be worrying about were just fever, shortness of breath, and cough. So I went through the day with the sore throat thinking it would just go away, and it didn't. So I happened to be talking with Lisa Maragakis later that day and mentioned to her my symptoms and told her I'd stayed home. And this was just about the time that we had started testing here at Hopkins. And given that I have so much contact with so many people at work, we decided it would make a lot of sense for me to come in and get tested. And that's what led to my being tested.
So Alan, as you think about those initial symptoms and then how the symptoms progressed and how that made you feel physically and also psychologically, talk to us a little bit about what that experience was like, how it progressed.
Yeah, that's a great question, Kevin. So, for me, it literally was just a sore throat the whole day, and I felt fine otherwise. Maybe a touch of malaise, but that was it. After I got tested, when I came home later that night, that's when the symptoms really got worse, and they got bad in a hurry. I started to have a lot of malaise and body aches, and later on developed a really bad headache. And that's kind of what happened on night one, right after my symptoms started. At that point, I was worried that obviously I had COVID-19. It was curious that I didn't have a fever or shortness of breath or a cough the whole time. And for the next 2 to 3 days, the symptoms obviously were there, and it wasn't fun.
Yeah, and when you talk about that, how would you describe your experience of being quarantined and how that impacted you? Because as your symptoms progressed, I know you and I stayed in contact and you did stay home, but talk to us about what that experience was like.
So when we actually think about people and their symptoms, I can tell you that while I was worried about my health, that was something we all worry about. My bigger concern actually was being on quarantine. Yes, being on quarantine, but the bigger concern was, what about my family? Because I had to be quarantined, that meant that my wife and my daughter had to be quarantined as well. And that's tough because you can't go outside your house. You sit there and you wonder, do you have enough groceries? Do you have enough food? Will you have the supplies that you need to be able to stay in for at least 14 days, if not longer? And that was the hard part. We first tried to isolate my daughter from me because we didn't want her to get sick. And she's young. She didn't understand what was going on, and she frankly didn't stay away from me. And then after my wife got symptoms 2 days later, we had no choice but to, in the house, allow her to roam freely with us. and be at home for about 16 days is what it turned out being in quarantine, and that wasn't easy.
Yeah, Alan, one of the things you described to me that I'd like for you to spend a little bit more time on is the profound fatigue that you felt at the back end of this. I mean, you were fatigued during the what I would call the acute phase of the illness, but talk to folks about how long it took you to really recover from the profound fatigue that you felt post-COVID.
Sure. I would say initially I got over my symptoms in 2 to 3 days, and I thought I was going to recover pretty quickly. And, I'd probably say I got back to about 80% of baseline after that. And I kept thinking I would just turn the corner the next day, but it turned out I constantly felt very tired for the next 3 to 4 weeks, just couldn't get over it, would have to go to bed early, would wake up a little bit later. And it was just there. And it was one of those things that you don't realize until retrospect. It was about 2 weeks ago when I look back now that I can finally say I'm back to 100%. I don't know what caused it. Maybe it's just because it's an first time new illness, but it was definitely profound, and it was definitely there for about 3 to 4 weeks.
So now you've gone through this, and as a physician, what would you say this experience has taught you about caring for patients with COVID-19?
Yeah. More than taught me, I think it's reinforced a lot of what we've known, which is that, patients, when they're diagnosed with something new, they often don't know how long it's going to take to recover. So if we can provide them reassurance on that basis, that's great. I think their biggest concerns, at least my biggest concerns, were my family. I was more worried about giving it to my wife and my daughter than I was worried about anything else when I was at home. So I think that's something we need to be cognizant of. Many of us also try to continue to work, which is what I did from home, because as we all know, we're all on Zoom all the time. To keep in mind, reminding our patients that they might want to take some time to rest. I was lucky that I had a good boss who would periodically check in on me and tell me to take it easy. But I think we need to be very cognizant of that as well, too. I think letting people know that it will get better over time is something that we can do to also reassure them. I think that's all those things that have been reinforced.
Alan, you bring up an interesting point, and I had the incredible opportunity last week to round at our Sibley Hospital, Suburban, and Howard County, and really talk to all of the healthcare professionals and what I call healthcare heroes taking care of our COVID-19 patients in all of those facilities. And, to a person, what I often heard was that they felt safer coming to work because, number one, they knew where COVID-19 was, and number two, they had everything they needed to protect themselves. And they felt less safe by going out into the community because they didn't know where it was, and they didn't have everything to protect them. So your point about how this is impacting a personal side of all of us, not just a professional side, is, I think, one of the differences as we try to respond as healthcare professionals to this and sustaining our own resilience. If you had to talk to everyone out there that's actually caring for COVID patients and knowing the resilience that it's going to take in the long run for us to respond to the trajectory of this pandemic, what would be your words of wisdom?
So there's a couple things I would say. So I would first start by just thanking all the frontline workers. I think we all knew that when we signed up for these jobs, that there was risk with everything that we do. But I don't think this was risk that many of us imagined it came with our jobs. And I continue to be just encouraged by the number of people who keep coming back to work and keep taking care of people. I remember when I got swabbed during the testing process, there were people out there with a smile walking me through the process and just making sure that we did it right. So I would say that please keep up the great work, because it's making a big difference to so many of us out there. And the other piece is, talk to the families and the patients about how they will be able to manage at home when they're trying to make sure that they don't spread this disease to others, because I think that, again, is what people worry about very much. We were lucky that we had family in town, that they would deliver our groceries to us and leave them right in front of our door so that we could get them, so that we wouldn't have to go outside. But I think the big words of wisdom are, continue to be as brave as all the frontline workers have been. Please, thank you so much for doing what you do. And continue to focus on, as we've all talked about, it's not just about their health, it's about their social situation and their families. We should continue to talk with families about that.
Thank you, Alan. Now, I want to remind folks that Alan's experience is one that of someone who tested positive, and we were able to send home to recover at home, which is the majority of our patients. But for those of you in our hospitals and in our intermediate care units and our ICUs, there's a segment of the population who does not do as well. And as Alan said, I want to personally take this moment to thank you. Having been in our hospitals, both Hopkins hospitals and Sibley, Suburban, Howard County, and tomorrow I'll have the opportunity to visit with our physicians and staff at All Children's Hospital. Clearly, you are doing incredible work in caring for our patients and families in a very meaningful way during a very difficult time in our world. And on behalf of all of the leadership of Johns Hopkins Medicine, I want to thank you for what you do each and every day, but for rising up in the midst of an unprecedented time to help us care for our community and being flexible. And I know as I've met many of you who are serving in roles and capacities that are new to you, that we have prepared you for. But your flexibility and willingness to serve is powerful and really underlines your commitment to our mission of Johns Hopkins Medicine and commitment to excellence. And so thank you for what you do. Thank you for joining us today.